Hello everyone and welcome back to my channel. So I am planning on doing 2 videos a month in January, and one is going to be health related, another one is going to be lifestyle. So I hope you are excited to join me on this journey and tune in. Don't forget to turn on notifications. I've talked about prednisone in the past and I am bringing it back because so many people are on prednisone and it is one of the confusing, risky drugs that we all have to go on when you have an autoimmune disease, usually. I do want to say that I am not a doctor or medical professional. I am just a patient who is sharing her own experience and my own wisdom with you. Always check with your doctor first. Prednisone is a risky medication to be on long term, and it is very important to never stop taking prednisone. You have to follow certain guidelines. It can be very dangerous. So what is prednisone? Basically, prednisone is a steroid that mimics cortisol in your body. And it can be given to you for anti-inflammatory purposes. Usually that is the case. Right now, I'm actually on prednisone myself. I have been for a few months for my autoimmune hemolytic anemia. Basically, my immune system is kind of going crazy and attacking my red blood cells. So prednisone is one of the few things that can help with that. It's not my favorite drug to be on, but sometimes it is a life-saving drug. Even though prednisone is a life-saving drug, there are a lot of long-term effects. There are short-term effects as well, like insomnia. You can get really hungry. I have a major appetite when I'm on a lot of prednisone. Right now I'm on 10 milligrams, so it's not as bad. I'm normalizing, and I can tell. You can also tell that it does mess with your hormones a bit, because I do get a little moody. But those are more short-term. In the long term, it can be more dangerous. Osteoporosis is one of the risks of taking long-term prednisone, and it's good to look out for this and make sure and ask your doctor and see if you should be on any supplements and what you should look out for. It does reduce the amount of calcium that you absorb, and it can increase how fast bone is broken down in your body. Another risk is diabetes, which is basically a steroid-induced diabetes. So that's something you want to look out for as well. Another risk is avascular necrosis. So this one always has scared me. This is a loss of blood supply to your bone. It usually happens in the hip. Just sounds painful to me. I'm sure some of you have had experience with this, and I am so sorry. Every time I see this, it just something that I'm scared of developing, because I have been on prednisone in the past and I've been on it enough. Another risk factor is it does increase your risk of infection, like many other anti-inflammatory drugs. Another big one would be steroid dependency. That is when your body does not produce cortisol on its own and it becomes dependent on the cortisol from the prednisone. That is why it is so important to make sure you taper your prednisone, because you want your body to naturally produce the cortisol again. If not, your adrenals could fail, and you don't want that to happen because that's not a fun condition. So be very careful. Make sure you talk with your doctor. In the comments below, let me know which of these side effects you have experienced. I know everyone who's been on prednisone has at least experienced one of those. Another one I forgot to mention is moon face. So I got a little moon face right here. You can kind of see it. If you look back at my old videos, or actually let me put up an example of me with no moon face and then with a moon face. This is what it looks like, and I will actually be doing a video on moon face in the next couple weeks, so look out for that. But that is all I have to say about prednisone, and really it's one of those things, and I've said this before, prednisone is kind of your hate it but love it medication, because it has saved me so many times, but the side effects are very scary and they're not so pretty either. So It's not a fun medication to be on, but sometimes it can make you feel on top of the world, especially in that first couple of days. In the comments below, don't forget to let me know your experience, and I hope you all are doing well. I look forward to posting more on here and interacting with you all. And yeah, hit that notification button so you can see my next video, and I'll see you then. Bye!